Good morning, and welcome to today's Fastcast. Their health is in your hands, what cleaning professionals need to know, sponsored by AeraMax. My name is Jeff Dreifhout, and not Mike Booth, as you see on the screen. Mike Booth actually is in the process of having his second child at this point in time, so congratulations to him and his wife. And my name is Jeff Dreifhout. I'm the Vice President of Global Development and Air Treatment for AeraMax, and so I have the opportunity to walk you through today's Fastcast. Just a couple of housekeeping notes real quick. If you take a look at the right side of your screen, you'll see a Q&A panel. If you have any questions, please, throughout the presentations, please feel free to go in there, type out that question, and if we have time at the end, we'll be able to talk a bit about through those questions and go from there. So with that, let's get going. So what are we really looking to do today? What are our learning objectives? And they're threefold. First, we're going to talk about and learn about the indoor environments and their impact on occupant health. We're also going to be talking a bit around the principles of cleaning for health in an environment. And then lastly, a plan to improve the health of your facility. And specifically, the angle that we're going to be focusing on is improving your indoor air quality, as it has a direct correlation to the cleanliness and health of a facility. So let's take the first one, the indoor environment and occupant health. How are those related? How are those connected? And why should we be thinking? How should we be thinking about the environment and how it impacts our overall well-being? Well, really, this idea of the indoor environment and occupant health is key because we spend a lot of our time indoors. We spend about 90% of all of our time actually inside, be it at work, at home, in an office, in different environments. Throughout the year, we're lots of times indoors, and many times we're spending our time indoors in what we call a shared space. And a shared space is a space that is sharing with other people, right? We're with other people, we're not necessarily alone. And so with that, the role of cleanliness and wellness is fairly key. And so what's interesting about an indoor space is that the facility manager is really seen now as a healthcare worker, and there's a high responsibility for occupant health. I think this is a great quote I'll just read here from Joseph Allen from Harvard School of Public Health. He says, "The person most responsible for your health is the facility manager, more so than a medical doctor. We spend so much of our time indoors that these people are critical. They can be thought of as healthcare workers because they're responsible for our health. And if that person is doing a good job, they are keeping everybody in that building healthy." And so that's just I think that's a spot-on assessment of the facility manager or someone who's responsible for the well-being, is that their actions, the processes, and the procedures that they put in place have a direct correlation and impact on an employee's well-being and health. So this facility manager as a healthcare worker really is taking advantage of the different trends that we see in facility management overall. We see a movement away from reactive to more proactive approaches to protecting occupant health. We're also seeking new ways to maintain and improve health as the facility manager, and this is really resulting in just more responsibility for a facility manager. It's not necessarily just solving a problem, but it's being proactive in ensuring that problems don't take place so that people can maintain their overall health and well-being. On this next slide, is actually a survey, and I'm actually going to turn it over to Paul here, who is going to walk you through the survey real quick. So, Paul?
Yeah, thanks, Jeff, for the introduction here to this event. And it is indeed time for this survey polling question. If you look to the right side of your screen, a polling window should pop up momentarily. And there it is. We just have one question for you today. How big a factor is occupant health in your facility cleaning decisions? A, we just try to meet OSHA's minimum standards. B, when there's a flu outbreak, we'll provide hand sanitizer. Or C, it's the basis for everything we do. We're always seeking new ways to provide healthier facilities. And I'll leave that polling window open for just a moment here for people to get the results in, and I'll come back in just a few seconds with the results. Okay, it looks like 83% of our audience said C, it's the basis for everything we do. Well, 8% each said just meeting OSHA's minimum standards, and then when there's a flu outbreak, they'll provide hand sanitizer. So those are the results. Jeff, back over to you.
Great, thanks so much, and hey, thanks everyone for participating in that survey. And it's great that the majority of the people here really talk about, are really showcasing the fact that occupant health is a big deal in our facility cleaning decisions. It's a big driver for what we're doing to provide healthy facilities. And so thank you for sharing that. And I think what you'll find here in the rest of this FastCast are different ways in which you can provide different approaches to improve the health within your facility. So as we all know that our role and a facility manager's role is important because it has a direct correlation to the cost. There is a lot of cost that's associated when people get sick and lost productivity. Over $220 billion in lost productivity. The average sick day, it's in the thousands of dollars per employee, and that's related to quality that goes down, the cost associated with bringing in additional help, things of that nature. And then we also know that the role of sick building syndrome, generates a lot of lost revenue. And so, a big problem is when people get sick or they're not present to do their job, there's a giant financial implication to the organization. As we know, the biggest cost for any organization is the people. And so we need to keep those people present, and we need to keep those people healthy. We also know that, that there are times throughout a year that people are just going to get sick. We're not going to be able to stop that. We can hopefully just contain that, especially when people are in shared air environments. Up to 20% of all U.S. residents get infected during flu season. What you see is that more and more that there's 36,000 flu claims. There's 17 million days that are lost each year because of the flu, and 38 million school days just because of the influenza virus. And so a very big deal and something I think we can all relate to. In addition to that, what else causes people to not be at work or not be at school? Allergies and asthma are a very big deal. We know that 1 out of 5 people have some sort of allergy. And so 20% of anyone that's in your building, this is a very relevant situation for them. And we know that what's in the air, the allergy and asthma triggers can cause just millions upon millions of absences, lost work days, and visits to the doctor because of the air that's in the environment within a particular location. So with that being said, let's move to the second learning principle. So we've learned a bit of why the environment is important, right? As a direct correlation on cost, the presenteeism of persons, of people, and their effectiveness. So what are some of the principles of cleaning for health? Well, one of the things that we've seen just overall is that most organizations take an approach of doing a couple things. One is cleaning surfaces, right? Being able to get those high touch points to keep those where people are going to be grabbing a handle. That's why touchless faucets, touchless types of sinks and toilets and things like that all really exist. We also know clean hands are key, right? And so the role of hand sanitizers and washing your hands and being able to keep those clean is all about avoiding transmitting surfaces. And so there's also traditional cleaning practices for the focuses of removal of germs and viruses and allergens. And so there's a lot of things we're doing to really kind of try to control the spread of germs from one person to another, primarily with surfaces and with hands. And so what do? We have programs around cleaning the hands with hand sanitization. We clean surfaces. We hire services to come in on a daily basis to constantly clean and monitor that. But the one area that I believe that gets neglected, unfortunately, is the thought of clean air, right? And so what goes in the air lands on surfaces. It gets ingested and breathed in by our employees. And so many times, though, it's something that really goes unthought of. And therefore untreated, and that has a direct correlation to the occupant's well-being that we'll be talking a bit more here about. So really it gets to, well, why should we clean the air? What's so important about that? We've already got, as the poll indicated, it's guiding everything to do is keeping our employees healthy and and productive. And are you saying that I've got to do more than just clean surfaces and cleaning our hands? And my answer would be yes, that the air is the area that we want to be looking at. And the reason for that is because what we put in our body has a direct correlation to our health, right? So let's take a look at some other categories. On average, we drink about 2.5 cups of water a day. We take in about 5 pounds of food a day. And just think about the level of importance we put on making right decisions. The quality of the water, the quality of the food. We try not to eat things that are too processed or bad for us because we know what goes in our body has a direct correlation to our overall health. Well, the air, we take in about 3,000 gallons of air a day. So very much exactly the same like we do water and food, air is something that we consume. And the quality of that air has a direct correlation to our health and well-being. And it's just something we need to be very aware of. And so what's interesting is that the indoor air is actually more polluted than the outdoor air. And as mentioned before, we spend about 90% of our time indoors breathing indoor air. We spend that time in shared spaces. And the fact is that everybody that walks into a facility obviously breathes, right? It's something that's happening involuntarily. So as people who are stewards of the health and well-being of a facility, anyone that walks in that facility and spends time in that is ingesting the quality of air that we put out there. And the question that I'll put out there is, how's it going? Indoor air is 2 to 5 times dirtier than the outdoor air. Most of the press that's out there is about air pollution, right? Outdoor air pollution. But when you bring that outdoor air in, and then you put a lot of people in an environment, all of that, the people introduce germs, they introduce viruses, they introduce dirt, pollen, things of that nature. And so there's bacteria, allergens, the equipment that we use, the materials that we use that are put in a facility like the carpeting, the fax machines, the copy machines, the printers, those are all giving off elements, contaminants that get into the air. And so all of that takes place, gets trapped within a building, and that's where we breathe it in. And again, we spend all of that time indoors breathing in those contaminants. And what's interesting is we were to focus specifically on viruses, is that as we talk, as we sneeze, as we cough, we're giving off different viruses. And so let's say as I sneeze or as I'm talking right now, there are large and small granules or droplets that land on surfaces. They land on hands. And so it's important that we do clean surfaces and high-touch areas because those areas are contaminated. The area that we're forgetting about is those infectious droplets. And those are so small, as someone sneezes, that infectious nuclei stays in the air up to 6 to 10 hours, and some studies say. And what happens is, think about that. If someone's in one conference room and they sneeze, and they walk out, 2 hours later, you might have that conference room walking in and you could actually be breathing in those infectious nuclei. And so that's a problem. And so despite all of our efforts around cleaning hands and cleaning surfaces, there's 1 billion colds that take place a year and 60 million cases of the flu. In fact, the cases of the flu have not improved over the last 10 to 15 years. And so it's really quite amazing with the additional steps that take place. The reason for that is the CDC states is that the air is actually more likely to transmit the flu than surfaces. And so while we're taking all of these actions to clean surfaces and clean our hands, what we're doing is we're forgetting about cleaning the air, and people continue to get sick over and over and over again. So it's a big effort for us is to clean the air. As I mentioned before, 1 out of 5 people suffer from allergies. And the amount of work-related asthma is one of the most prevalent occupational lung diseases. So the ability to keep air clean also avoids people from having asthmatic triggers or any sort of allergic reaction because it is triggered from items that are breathed in. In addition to that, you may have understood or have heard things such as volatile organic compounds or things called VOCs. And what those are, they're odorless, they're invisible, but there's more than 11,000 products that give off VOCs every day. And it can be things like copy machines, fax machines, it can be the carpeting, the insulation that's used. It could be your desk based on the material that's used. And what happened is it gives off an emission into the air that you don't even know about that. And so that impacts people that have asthma, that have headaches, and it can trigger allergy attacks as well. And so what we see here is that indoor air impacts everybody. It impacts everyone, all of your workers, all of your vendors, anyone that's in your room, your customers, and it's really important for us. And so what we also see is that by having clean air, that there's actually improved productivity. There are many research studies out there, and one I see in particular, that shows that students and workers' performance is significantly better in conditions with good indoor air quality. So indoor air matters, and it's really not surprising if you think about it, right? If you drink water, or if you drink products that aren't great for you, or if you eat junk food instead of healthy food, it impacts your performance. It impacts your physical performance and your mental performance. And the same thing takes place with air. And again, we are breathing in 3,000 gallons of air, so certainly we want to have cleaner air from which to breathe and to impact our performance. So the last piece I want to share here is just what are our strategies then for improving indoor air quality. We know that the role of a facility has a direct impact on our wellness, and we know that the air can be a big part of that, and it's usually a cleaning effort that we're not thinking about today. Well, the Environmental Protection Agency actually recommends 3 main stages for improving your air quality. The first of which is around removing. So if you have something that is bad, radon, asbestos, get it out, remove it, get it out immediately. And so that's something that that the EPA will certainly recommend right away. The second one that we talk through is venting. So that's why your HVAC systems exist, right? It's to move air along. It is also to continue to keep the ventilation going. But HVAC systems are not necessarily designed to clean. They're designed to heat. They're designed to cool, but they're not designed to remove things. And that's why this third zone of purifying, it's about removing the germs, allergens, and odors. And the EPA says this is a key final step in being able to improve your total air quality. And purification is something that is just so important for us. You don't really rely just on your HVAC system to take care of your air. It's designed to it's a heater and an air conditioner, right? And it's also kind of designed to keep your humidity at a certain level, but not necessarily for cleaning. Really, the analogy is that what an HVAC system does is basically moves air around, and if that air contains germs, what it's doing is it's basically just transferring a problem and germs from one room and distributing that to other parts of the organization. So in many cases, the HVAC system is actually contributing to the spread of germs and allergens and things like that. So what do you got to do? We need to remove it. And so applying air purification to improve your indoor air quality in problem areas is absolutely key. So as an example, for a case study that we have where an organization introduced air purification as part of their cleaning efforts, an indoor air quality program saw several different benefits. First of which, the airborne dust that was inside the building decreased by 52%. And this is important, right? Because not only are you breathing this in, but this will also help with your cleaning efforts overall. What goes in the air will land on something, right? And so that's very important to save on cost and time in cleaning. The second is VOC concentrations were cut in half. And again, as I mentioned before, VOCs are something that are not detectable. You can't smell them, you can't see them, but they have a direct impact on your health and well-being. The bacteria that was around decreased by 40%, which is significant. And then lastly, fungi colony forming units decreased by 60%. So again, being able to clean and improve the quality of the air by 40 to 60% of bacteria and fungi of what would then normally being ingested or consumed by anyone in your building is pretty significant. So the key is about cleaning the air. Air purification removes rather than redistributes the vast majority of airborne pollutants. ASHRAE, which is basically the leading guidance of building codes, has even put out a white paper saying that one of the biggest ways of germs spreading within an environment is an HVAC system. So really what we need to do is to be able to clean and capture that and remove it rather than just redistributing that. And the ways that can be done is that AeraMax actually removes about 99.97% of any airborne particulate and odor. And it's done it with four-stage filtration. You want to have strong filtration in order to clean the air. A pre-filter will capture and remove large particles and contaminants. the carbon filtration actually takes the odor and absorbs the odor and also those VOCs. So as that air is moving through, the VOCs get captured. The next stage is through True HEPA filtration. This is like hospital-grade filtration, is where you're capturing things that are as small as virus levels, okay? And then in addition, there is the ability to use ionization, if necessary, to hammer down bacteria, viruses, and break them down so that they are no longer effective, okay? So as we think about the role of purification, it's important because you want 100% of those allergens and viruses removed. You want the ability to get the odors and VOCs gone. And the great thing about AeraMax is it's done in such a way where it's got technology in here where it will automatically detect the environment and clean it accordingly. Nothing that you need to do. It's really set it and forget it. We know that every location is not the same, and every room size is not the same. So we've designed a variety of different sizes that can address your areas, anywhere from 300 square feet up to 1,400 square feet. This doesn't use chemicals, completely energy efficient with less than $10 of electricity used each year. It's constant cleaning, so it is 24/7 constant cleaning that takes place, and less airborne dust and germs means less cleaning that takes place. So the impact of air purification is significant. What you see here is actually a computer model that is used and this is a women's restroom with 6 toilets. And so with no air purification, as all those toilets are flushed, what happens is all of that red is bad, blue is good. And what happens here is when a toilet flush, what goes in the toilet does make its way up into the air. And even as you see with the HVAC system, it spreads around the air within the room, and the quality of the air that it's spreading around is important. So in this case, dirty air is getting distributed throughout the room. With AeraMax Professional or with any air purification specifically over the stalls, you'll see that the purity of the air is so much cleaner. And so as someone who might be entering into that room, I know which room I certainly would want to be going into in order to have a clean environment. Just another proof point in this example here, this is actually the measurement of the amount of dirt that is in the air. And what you see is that this was a healthcare facility, and it had 0.3 microns. This shows the dirtiness of the air. This was before air purification. And so what we see is as we introduce and we've added purification in only a matter of about 30 minutes, there was a 70% reduction in total particles that took place. And so that's a reduction of the flu, allergens, dust, mold, viruses, all of that within just a short period of time. So having an immediate impact of cleaning the air is important. So with that being the case, where do we put this? And we would say, well, clean where it's needed the most. One of the areas that's a constant source of contaminant that I would be looking at would be a restroom. It's a place where there is obviously, as I showed earlier, a lot of contaminant that can take place with flushing toilets, especially ones that don't have seats or lids. But in addition to any place where people gather a lot, that could be a classroom, a conference room, maybe coffee areas, a cafeteria where they gather a lot. So with that, I just wanted to thank you. Hopefully we've been able to achieve our objectives here of learning a bit more about the environment and how that directly connects to how the environment specifically connects to the health and well-being of a facility. The role of air is something that we would say that we would add to additional cleaning on surfaces and hand surface areas as well. And so that's key. So with that, I'd like you to think about the air, and I'll take a look. We've got an maybe a couple questions or a couple seconds here to answer a question or two. One of the questions that I see here that usually comes up is, how often do you need to change out the filtration on this? The filters that we have on the AeraMax units only need to be changed out once a year, and so very low amount of times that needs to be done there. And so what we would just say is think about the air as part of your overall cleaning efforts. With that, I would just want to close up and say thank you very much. I presented on behalf of Mike Booth here, who is obviously having a kid right now, but if you've got any questions, certainly you can learn more at airmaxpro.com, not only about our products, but you can learn more about the air and how that relates to your environment. Mike Booth at mbooth@fellows.com. You can certainly follow up with him for questions and if interested in learning more about cleaning with your indoor air. So with that, I want to thank you very much for your time and have a great rest of the day.